The average age of our health infrastructure is 47 years, which is creating significant challenges, including buildings that require major remedial work to avoid service disruption, facilities with poor seismic ratings or serious compliance risks, outdated infrastructure that is unable to support modern models of care. The Health Infrastructure Plan addresses this challenge by setting out a clear long-term plan and also looks at how we can build our hospitals in a staged way using delivering smaller, more manageable facilities and more standardised designs. This means that we can then work with the construction sector to deliver more and provide services sooner to patients. It also includes the planning and initial building of the recently announced new hospital, which is required in South Auckland, and also requires upgrades, remediation and hospital plans across the country. Each project in the pipeline will require its own business case and will go through normal funding approval processes by Cabinet. While the infrastructure deficit will take time to address, this plan is a critical step forward. It outlines what needs to be done and how we will do it, ensuring New Zealanders have access to modern, safe and reliable health infrastructure. I'm also pleased today to announce that works will recommence on the new Dunedin hospital site at the middle of this year. An advance notice we published on GETS, the government electronic tender service, today to complete the substructure of the building, which is a critical next step while commercial negotiations for the main construction continue. The substructure is a vital foundation of the main hospital build, and by continuing to deliver the next stages of this while commercial negotiations are underway, we're able to continue to make progress on what is a critical infrastructure project for Dunedin and Southland. So look, thank you for being here, and with that, happy to take any questions.
The plan identifies that a $20 billion investment is needed in health. Will the government need to find that money, or are you considering private investment?
Look, this is a long-term plan, and yes, it's going to require a significant amount of investment, and we've been clear that we're open to all types of funding and financing to deliver that, whether that's public-private partnerships. Obviously, the Crown will need to also contribute over time, as it always does. We've got $6.7 billion of Crown, major Crown delivery projects, such as the one behind us, underway across the country as we speak. But ultimately, yes, we're open to all types of funding and financing opportunities to be able to deliver the infrastructure that New Zealanders expect in their healthcare system.
Yeah, how will the government find people that are willing to put in?
Well, that's where we've already started engaging with the market. That's where we had the infrastructure summit last month, which was all about engaging with investors from around the world and also locally in New Zealand, whether that's iwi or local investors in New Zealand who may wish to invest in health infrastructure. As I said, we're open to all types of funding and financing opportunities to deliver the health infrastructure that we need. And by having a long-term plan, it allows Health New Zealand to now engage with the market around where the market may be interested to invest alongside the government. Well, we've clearly outlined what's required. It's based on a clinical needs assessment as to what's required across the country, and ultimately we will engage with the market to deliver what is needed for New Zealanders. But this provides certainty now to Health New Zealand and to investors as to what's required, and allows for those conversations to happen.
Now, it mentions more smaller and more deliverable projects. Can you detail kind of what they would look like and perhaps where we'll be able to expect it?
Well, it allows for more staged types of developments. So rather than necessarily rebuilding entire hospitals all at once, it could be new, replacing the acute services building and then replacing the inpatient wards. But it's doing that in a staged way so the market can cope with that and actually be able to respond to that. A lot of our hospitals are in regional parts of New Zealand. They don't have the size and scale of the construction market we have here in Auckland or in, say, Christchurch or Wellington. And so it's really important we're building things in a staged and deliverable way, which is more cost effective, but also more deliverable for our construction sector. And also it means that if you do things in a staged way, you're able to bring those services on board sooner, which means patients get that care and those new models of care quicker, as well as the healthcare workers are able to move into those new modern care facilities and work in those sooner as well.
In situations where there's significant issues like seismic issues, is this an opportunity to perhaps just start completely new in that area?
Well, sometimes it would require new builds. Some will require refurbishment and strengthening of existing builds. And so a big part of the plan is actually looking at what is the infrastructure we've got, what's required to modernise it and make sure it's up to standard. And so a lot of the work that's going to be needed is actually refurbishments or rebuilding or reusing what's there, but also we're going to need new facilities as well. Right behind us is actually an example of both. You've got 12 new operating theatres being built here at the Manukau Health Park. You've also got refurbishment of the existing premise underway. That's an example of what's going to be needed across the country, reusing what we've got, whilst also building the new capacity needed for a growing and ageing population.
Will you stick to the election promise that National Aid for blood cancer patients to fund the drugs recommended by the Cancer Control Agency?
We have invested a record $600 million more to Pharmac to fund the drugs that we campaigned on at the last election. That is now being rolled out, and not only will it fund those cancer drugs, but also it'll fund dozens of additional treatments which will impact the lives of tens of thousands of New Zealanders. We are incredibly proud of the investment we've made, but look, there's always a need for more in terms of there's new drugs, new treatments, and we'll continue to assess that. But ultimately, we have invested significantly more into Pharmac, and we continue to, and the Minister responsible, Honourable David Seymour, continues to work with patient groups as well around what more is needed.
Will you commit to doing so in this year's budget?
What we've committed to is what we provided last year's budget was $600 million more over 4 years, which is about increasing the amount of funding for Pharmac so they're able to provide more drugs, more medicines for patients so that they're able to get those modern treatments that they deserve.
So no, this promise won't be stepped in?
We have committed the $600 million over 4 years, provide a record uplift in Pharmac's budget to invest more into treatments and medicines, and I'm really proud of the fact that that is being rolled out across the country right now, and thousands of New Zealanders are already benefiting from those new medicines.
But are you even considering or looking at funding this budget?
Well, what we've committed to is in the last year's budget we funded a record investment in Pharmac. It's about providing new cancer treatments. Those are still being rolled out, so Pharmac is still consulting and they're still rolling out the medicines that we funded in last year's budget, and that is providing a huge amount of care to many New Zealanders.
In terms of resourcing these various hubs you're going to build, how are you going to do that at the moment with understaffing, particularly in the region?
Well, we've got record numbers of doctors and nurses under this government. We've increased the number of doctors and nurses in Health New Zealand. We're going to continue to invest in frontline services so that we can obviously continue to provide that support that is required to New Zealanders. It's also why we're going to invest in new models of care so we can ensure we're providing those new models of care to deliver for patients. But that's where the workforce plan that Health New Zealand has, continuing to work with the frontline staff to deliver the services needed across the country. But we have invested a record $16 billion over 3 budgets into health. That is to provide for the increased costs, the increased resourcing, and we're very focused on frontline service delivery.
Yes, the message from frontline staff this week has been that hasn't been enough, and doctors have been striking first.
Yeah, and my message to the unions is very clear. Don't use patients as bargaining chips. People will have their hip operations, their cataract operations, and their knee operations cancelled because the union has decided to put politics ahead of patients. I find that frankly unacceptable. These are some of the most well-paid public servants, and what they should be doing is going back to the negotiating table rather than putting politics ahead of patients.
The Minister, on that, on Morning Report this morning, the association challenged the figure you cited that an average senior doctor is paid. You said it was $343,500. Where did you get this figure from?
Well, that is advice from Health New Zealand as their total remuneration. It includes things like their KiwiSaver contributions. It includes payments for availability allowances and other payments. That takes into account all of the various payments that they get, as well as their base salary. And it's just like how most employers will treat their employees with a total fixed package, which includes all of those elements. But what I would say is these are some of the most well-paid public servants in New Zealand. They play a critically important role in providing patient care. And what I say to that union is you can't complain about waiting lists whilst you're going to make waiting lists longer at the same time. That is what they're going to do. People waiting for hip operations, cataract operations, or knee operations will be waiting longer for care because what this union has decided to do is put politics ahead of patients and using patients as a bargaining chip. I find that frankly unacceptable.
At the top end of the pay scale, they're saying in New Zealand, senior doctors aren't being paid, they're getting paid less than the lower end of the scale of their counterparts in New South Wales. Is that acceptable?
What I'd say is these issues should be dealt with around the negotiating table, not using patients as bargaining chips as part of a negotiation. I find that appalling. They need to get back to the negotiating table. Health New Zealand remains available at the negotiating table to deal with these issues rather than using patients as bargaining chips. I find that frankly unacceptable.
Are you concerned about New Zealand losing highly qualified doctors to Australia?
Well, we have more doctors, more senior doctors working in Health New Zealand now than when we came to government. The turnover rate is lower than when we came to government. We are focused on frontline service delivery, but what I would say is all of these issues should be dealt with around the negotiating table rather than playing with patients and putting politics ahead of patients. That is what they're doing, and they're doing the strike on May Day, which of course is a union, a well-known union day. They are putting politics ahead of patients rather than actually going back to the negotiating table, which is where they should go.
Do you accept what you're saying about understaffing, putting patients at risk?
Look, there are challenges across our health workforce, and there is challenges which should be dealt with around the negotiating table rather than using patients as bargaining chips. Thousands of Kiwis waiting for hip operations, cataract operations, knee operations and other procedures, first specialist assessments, are going to have their care delayed. They have already been waiting far too long because the union has decided to put politics ahead of patients. As I said, these are some of the most well-paid public servants. They receive as well, on top of that, 6 weeks annual leave per year. They have 3 months sabbatical every 6 years. These are well-remunerated public servants who play a critically important role, and they should deal with these issues around the negotiating table, not using patients as bargaining chips.
Is the stage smaller?
2 more questions.
Is the stage smaller patch-up job approach you're taking going to future-proof the health system, or does it put the population growth problems?
Well, I reject the premise of your question. This is a staged development for hospitals across the country. It is the first time we've had a long-term plan for hospital investment in New Zealand. And I'm on the side of investing more into hospitals so that Kiwis can get the care they need in a timely and quality manner. That's the plan we've released today, and it means that it's also deliverable working with the industry.
So is it future-proofing the health system?
Absolutely. This is a long-term plan of health infrastructure that's required across the country, redevelopment of existing facilities, building new facilities, growing capacity so that New Zealanders can have timely and quality access to healthcare. Hey, well, thanks everyone. Now we've got an opportunity to go for a walk through. Here we do need to just make sure we get hard hats and vests on. So I'm going to pass over to the team. But as I said, this is a fantastic new facility under construction, and it's a good opportunity to get inside and have a look.
Okay, so just quick.